coming up.
But what we're asking is simple questions on behalf of Canadians when we know.
No, I'm just curious. What's your point? Do you have a point?
I have lots of points. Well, let's start with the first point. You have no idea what you're talking about.
Minister, I'm wanting to bring forward an amendment to ensure that there is a representative that is named by every single province and territory across the country to make sure that their voices are heard when it comes to the Committee of Experts. Will you allow the Liberal NDP members on this committee to support that amendment? Yes or no?
Talked about the creation of the Canadian Drug Agency, which I understand should have been stood up around May 1st. Given that you could have actually had created an agency which has significant oversight, which maybe you don't realize it should have, because the approvals that are actually done through the process, including Health Canada, PRB, the new CDA, PCPA, et cetera, are the worst, some of the worst at least, maybe not the worst, some of the worst in the country. So you could have actually changed that.
This guy's garage. Like and subscribe.
You talked about access to primary care. Can you tell the committee how many Canadians do not have access to primary care?
It's high. It's, of course, regionally dependent, but far too many Canadians don't, and that's why we're working on these agreements.
Across the country, Minister, how many Canadians don't have access to primary care? You know the number.
Well, it varies, and sometimes it's difficult to know, actually, because the circumstances are too opaque. We're missing a lot of the data that we need in health to be able to give precise numbers. So they're best guesses, but the number is too high, and I've seen a lot of numbers all over the map.
Minister, you're too afraid to say the number because under your watch it continues to increase. Is that not true?
Well, no, actually. Under the last 10 months, we've made huge progress. On my watch as health minister, we've signed 26 agreements, moving forward with $200 billion in funding. And I think you wouldn't find an association or an organization that represents nurses, doctors, personal support workers who isn't saying we're making tremendous progress and have over the last year.
Well, it's interesting, though, ministers, because you've refused to give a number, but now you're telling Canadians that you've made progress. If you can't even count the number of people, how can you tell that you've made progress?
One of the things that we did in the agreement that I think is critically important is put common indicators across the country and prioritize health data so that we don't have that level of opaque nature to our health system. I think that we have provincial and territorial governments. It's essential that we have common indicators so that we can have clear and concise answers to these questions. So that was one of the things we built into that.
Let's just give a number. How many Canadians do not have access to primary care? Just a number. How many million?
Too many. We don't know the number.
That's not a number.
Well, we don't know the number. I've tried to explain that we can't. It's an unknowable number because.
Minister, except you.
Well, if you know the number, then say it. And where does it come from? Can you cite the source?
Thanks very much. Maybe I'll try one of your associates here. Mr. McDonald, do you know how many Canadians don't have access to primary care?
Per the minister's comments, that's information that's being collected pursuant to the agreements that have been signed.
So here we are. We have, and maybe Madame Boudreau, could I ask you the same question? How many Canadians don't have access to primary care?
Thank you for your question, Mr. Chair. I wouldn't be able to add anything further.
So what you're telling me is we have 3 officials, including the Minister of Health, who have no idea how many Canadians don't have access to primary care. Wow. This is going to go a long ways to helping Canadians then. How about this, Minister? Semaglutide. Why is it not on your list of medications?
Well, what we did is create a base. So one of the things when we're negotiating with provinces is to say this is just a floor to make sure that we have for those who are uninsured or underinsured, that we have a floor. So, we're absolutely open to both the committee's comments and negotiations with provinces to be additive. I would say that the list that you see is an absolute minimum, and I would expect there will be no final list that doesn't include more. So if there's things you think should be on that list, I'm actually quite interested in having that conversation. Hopefully it would mean you support the legislation.
Yeah, I don't think we need to worry about that because it's bad legislation. It's bad for Canadians. Can you tell Canadians how long it takes in Canada on general from first launch to public reimbursement for a medication?
Well, again, varies by province, but again, I would take it back. I hope that you won't just summarily reject the idea of helping people who are uninsured get medicine. I would ask you, if not
Minister,
this
I don't
plan,
think
what
that
is
was my
your plan,
question.
sir? So there's
I think that my
1.1
question-
million
excuse me, Chair.
uninsured Canadians.
I believe,
Could you tell us what your
Minister,
plan
that my
is to insure
question-
those folks? To make sure that people
You know
who
what,
don't
Minister?
have medication have medication.
You'll
What
have
is
your
plan,
chance to
sir?
ask me questions at some point when you're sitting in the opposition. But can you tell all Canadians the number of days from global first launch to public reimbursement, how many days in Canada?
Again, when you're talking, depends on the medication, depends on the jurisdiction. But I would put it back to you. You know, if you were going to vote against something, my preposition would be that you have to explain what you're going to do in its place. So if you have all of these folks who have no insurance and no medication, it's a pretty simple question to ask back, what are you going to do in its place? And you say you have no answer, then I would say, why are you voting against this?
No, I didn't say I didn't have an answer. You're the person who's given me, I've asked you 2 questions now, simple numbers, which you do not know the answer, nor do your officials. Third question, simple number, let's try another one. Percentage of new medications available by OECD country, 460 new medicines launched from 2012 to the end of 2021. How many are approved in Canada? What percentage? Just the percent.
Yeah, I'll just be straight with you. This is like, what is your purpose? Like, what are you trying to ask? Like, I understand you're trying to play a gotcha game here instead of, I'm trying to talk about people who don't have medicine, and you seem to be lost in some kind of partisan, like, weird thing that you're doing. Like, do you have a plan for people to get medicine, or do you not? And is this an attempt to obfuscate the point that you don't have a plan?
You're trying to do, we can talk about those. But what we're asking is simple questions on behalf of Canadians when we know.
Why? No, I'm just curious. What's your point? Do you have a point?
I have lots of points. Well, let's start with the first point. You have no idea what you're talking about. Second point is Canadians wait the longest time in OECD countries for approval of medications, which you clearly have no clue about. We're back to that again. Sadly, the last time you were here, you had no clue, and you remain clueless, obviously. The percentage of new medications available in Canada, 44% of 460 medications. What that means is despite the fact that you want to go out and announce things that are untrue and not even happening, the system that you have, the regulatory system that you, sir, have control over, is failing Canadians. You had an opportunity to change that. You have chosen not to. You have chosen to attempt to keep yourself in power with your NDP costly coalition partners by creating something that already exists at provincial levels.
That's your time.
Thank you very much, Chair.
If you want an answer, okay.
I think we've already provided the answer, Chair.
Is there anything in this legislation that will prevent employers from canceling or downgrading existing insurance plans?
Well, there's nothing that would change that. I was the head of Heart and Stroke, so I negotiated private insurance plans. I can tell you that that for insurance companies, they very much want to continue their businesses. So the fact that underinsured and uninsured people are now going to have the ability to get the medicine they need represents no threat to insurance companies. I think that. Well, but that gets to it. I mean, if you're an employer, as I said, I would negotiate the health benefits for employees. Obviously health benefit employees include much more than just diabetes drugs and contraceptives. So
I'm asking if
to drop your plan because a portion of medicine it's just not logical, right? No company would do that.
All right. So if this is a single payer program, is anyone going to lose coverage from existing plans?
The objective here, no. We're making sure that people have choice, so that allows people to have a choice about where they would go. So, for example, if you had somebody with 70% coverage and they can go to a public plan with 100% coverage, I imagine that they would make that choice. But if they prefer their private plan, they could continue to use their plan. So
you can assure us that no one will lose coverage based on this legislation?
I can assure you, yes.
Okay, thank you. So what consultations did you do specifically with Minister Adriana LaGrange in advance of putting forward this bill?
Yeah, I had conversations with all ministers, including with Adriana, and obviously there's a lot to settle. We just know that we're talking here about diabetes, drugs, and contraceptives, but there's been positive conversations.
She's stated that you did not consult with her before putting forward this bill.
Well, she and I have talked many times. And
Did you do it before putting forward this bill on this bill?
Yes, but I mean, I think that I want to be careful because if I could, Mr. Chair, if I could be precise, because I don't want to mischaracterize it. Obviously, but before the introduction of the bill, those conversations had to be very high level. So
Okay.
in fairness to her, there were not detailed conversations because, of course, I would have been precluded from having those. But
Thank
we
you.
had conversations before and after
So-
generally about it, yes.
What about with Everett Henley from the minister in Saskatchewan?
It'd be the same thing. I mean, obviously, before a bill exists, I can't, share something of that nature. That would be violating and disrespecting Parliament. But at a very high level, for sure, there were conversations with Everett and in Saskatchewan and elsewhere about the general concept, and that I
Okay,
would come back to
so,
him with more details.
Minister Henley is saying that you also didn't have specific conversations with him in advance of this bill. So my question becomes, if you didn't have conversations with the two ministers from Alberta and Saskatchewan, and we know Quebec has shared some concerns regarding provincial jurisdiction. We've had Saskatchewan, Alberta, and Quebec all state that they want to opt out of this program. Why did you not just put your ego down and work with the existing provincial government and their existing plans to provide the coverage for those gaps?
Well, that's precisely what we're going to do. I mean, I
That's
can't.
not what this bill is.
Well,
This is not what this bill does.
Mr. Chair, if I could be afforded the opportunity, there were a lot of people who said we wouldn't get an Aging with Dignity or Working Together agreement with Alberta or Saskatchewan. Of course, we did. And I can say that on this subject, that we've had very productive conversations around the needs in those provinces. I couldn't go into the level of detail of what would be in a bill. That would have violated
so
parliamentary privilege. But
Do you
afterwards,
have
we've
deals
had
with
very
these provinces?
constructive.
Do you have a deal with Alberta, Saskatchewan?
We do. We have
Quebec?
deals with there are 26 deals across the country. Yes, we have deals with every single province, every single territory on healthcare. They were negotiated collaboratively, and I'm very confident we'll get a deal on pharmacare as well.
On pharmacare, do you have deals with the provinces on pharmacare?
Well, that would violate Parliament. Parliament needs to adopt this legislation before I could do that. So I would be violating. I'd be negotiating with no parliamentary authority. I'm not allowed to do that.
Your committee of experts, will it have representatives from provinces and territories?
So I'm open to your feedback. If you
Can you
the
commit
committee
to
of experts,
having-
I think is exceptionally important that we have people who understand the current
Okay.
context, and that obviously
So-
provincial consultations with provinces and territories will be
I'm
a
wanting-
critical part of their process.
Minister, I'm wanting to bring forward an amendment to ensure that there is a representative that is named by every single province and territory across the country to make sure that their voices are heard when it comes to the committee of experts. Will you allow the Liberal NDP members on this committee to support that amendment? Yes or no?
I don't think consultation any more than federal provincial consultation.
So you won't
is-
support that amendment?
No, and I'll tell you why. 'Cause, I mean, that's an extraordinary number of people for an unnecessary outcome. I mean, negotiating
So
with
you
the provinces.
don't think
I talk-
negotiating with provinces is a good idea?
I do that every day. I mean, there's not a province or territory that I'm not speaking to on a daily basis, and that will continue. I've been to every province and every territory at least twice with the provinces, and once in the case of the territories, and I'm talking every day with them. So
I think that is
consultation
exceptionally
is an
condescending to
ongoing
provincial
process.
Thank you,
provinces
Minister.
that have their
Thank
own
you, Ms.
jurisdiction
Goodrich.
on this.
That's your time. Dr. Ellis and Mr. Steinley, I think, are going to split the next turn.
That's correct, sir.
Okay, Dr. Ellis, you have the floor.
Thank you very much, Chair. Interestingly enough, in this legislation, it talks about a universal single-payer system. So can you explain that a bit, and not in your usual, ongoing fashion that you like to do, but can you simply explain that to Canadians and what that might mean?
Sure. It means that somebody is going to be able to get the drugs that they need without having to pay.
Okay, great, interesting. So if somebody has pre-existing coverage, and my colleague talked a bit about this through their employer, this program, why would employers continue to offer their employees a program if this is going to exist?
So employers offer much more coverage than we're contemplating here. This is a very, very tiny sliver of what employers offer. So I can tell you from negotiating these things that there is not the opportunity to go a la carte. And if you try to pull out a tiny fraction, you're not going to save very much. And what you're going to show to your employees is that you're not serious about them. What I've seen from the insurance industry is that they're very anxious to maintain their coverage and their business. And what I've seen from employers is they're anxious to make sure that their employees continue to get coverage.
Again, you just have to go on and on and on. Maybe you could just try answering the question instead of your political grandstanding. So that being said, though, what you've now said is that what you've created is a very basic, inferior program on behalf of Canadians. So I find that absolutely interesting. Built into this bill, you talked about the creation of the Canadian Drug Agency, which I understand should have been stood up around May 1st, which is something actually in your purview as the Minister of Health. So I'll give you kudos on that. Given that you could have actually had created an agency which has significant oversight, which, you know, maybe you don't realize it should have, because the approvals that are actually done through the process, including Health Canada, PRB, the new CDA, PCPA, et cetera, are the worst, some of the worst at least, maybe not the worst, some of the worst in the country. So you could have actually changed that with this legislation, but you chose not to. Can you tell Canadians why they're going to be left out in the cold waiting for new medications?
Well, they're only going to be left out in the cold waiting for new medications if you're successful in stopping them from getting their medication, in the first order. And the second order, Health Canada is known around the world, not only for the rapidity with which we approve applications, but the quality. Canadians should feel very proud, not of me, but of our health officials who every day do extraordinary work to make sure that the products and the medications and the food that they consume is safe. And I think that to cast any shadow on that would not only be not connected to fact.
I think that what I asked you about was the Canadian Drug Agency and why you didn't put some oversight into this bill with respect to the Canadian Drug Agency. It's not my plan to stop Canadians from getting drugs. You're the one who would be responsible for having some oversight of the CDA, which you do not have. Why did you choose not to do that on behalf of Canadians?
I would say that through our existing mechanisms, we have very strong oversight, and that we are recognized as being one of the best regulators in the world, and that when people look to approvals done by Health Canada, that they know that that is a gold standard to which other countries look up to. And I'm extremely proud of the people that work in our public service every day to do that.
That were brought forward from 2012 to 2021. The Canadians would only have access to 44% of those. You think that's okay?
I think that we have to be.
Yes or no, Minister? Is that okay or not?
Well, you don't get I don't get to dictate your questions. You don't get to dictate my answers.
Yeah,
and the answer is
a simple yes or no.
Answer
is it okay? Yes or no?
The answer is that when we approve medications, ensuring they're safe and ensuring that people aren't hurt,
is it okay
making sure that they don't injure people's health is a hallmark of Canada's drug approval system that I'm deeply proud of.
And all you choose to do is continue to talk, which is,
well, I don't know. You don't seem to want to let me answer.
You have
a interesting.
Point of order.
Mr. Julian on a point of order.
I think the tradition around this table has been when you ask a question, wait for the answer. I would appreciate it if we could get the answer.
Yeah. Dr. Ellis is correct, but there have been violations by both the person posing the question and the person answering the questions throughout this round, quite frankly. There's about a minute left in your turn, Dr. Ellis, if you want to share with Mr. Steinley, or if you plan to.
That's correct, Chair. The rest of the time is for Mr. Steinley. Thank you.
Okay. Thank you, Mr. Holland. Did the Minister of Saskatchewan ever ask for dental care or pharma care from your government?
I think they've asked a lot of questions about how we can work together and on dental care, and those questions have been productive. I've expressed to both jurisdictions that if they wanted to operate those programs provincially, as long as they were at the same cost and same quality, that I would be open to that.
I have, from the Minister of Health, we've never asked the feds for dental or pharma care. So is he not telling me the truth, or are you not telling me the truth?
Well, I don't. You can ask him whether or not he wants dental care or not. I mean, dental care for 9 million Canadians is coming. Well, I can tell you that, and I've had very good conversations with Everett. I have an enormous amount of respect for him. When he and I have sat down and talked, it's about how we can work collaboratively.
And one more quick question.
He's never said to me that he doesn't want dental care for people in Saskatchewan. If he said that to you, that's not.
One more quick question. Do you know how much coverage we have in Saskatchewan right now when it comes to diabetes, the diabetes programs in Saskatchewan, and the senior drug program in Saskatchewan, what the coverage is?
Yeah, no, I think, Saskatchewan has done a good job. They have a good program. There's still a lot of gaps, and there's a lot of things we can do together, and Everett and I have talked about those gaps and about how we can improve them to make sure that everybody has care.
Can you tell me what age is covered in Saskatchewan
But I think I would commend Saskatchewan for the work that they've done, and I do agree that Everett has done a good job as a health minister.
Okay.